Good morning, everyone. I welcome you all to my Health Corps second webinar 2025. Please, can you all mute your microphones, please? Hello, good morning. Can you all confirm if I'm audible enough?
Hi, good morning. Yes, we are audible.
Yes, Madam, you are audible.
Thank you very much. My name is Adomante, and I'll be your moderator for today's webinar on the topic Men's Prostate Health. The webinar is going to be in three parts. The first part is going to be the introduction of the My Health Corp ecosystem, which will be done by the founder and CEO of My Health Corp, Mr. Kwesi Tebri. Then we'll have our main presentation, today's webinar. Then we would also have an AI demo, which will be done by my colleague Philemon Saffron. So without further ado, let's kickstart today's webinar. I welcome on board Mr. Kwesi Tebri, founder and CEO of My Health Corp ecosystem. Good morning, Kwesi.
Hello, do you hear me?
Yes, we can hear you.
Okay, perfect. Yeah, good morning, everybody.
Good morning.
Yeah.
I believe you are doing well.
Perfect. Good morning, everybody. As always, it's a pleasure for me to introduce our ecosystem and explain a little bit where we are coming from, where we want to go, and how we will do to reach to our destination. Yeah, come on. Yeah, I think that is not a lecture. Let's Chief will share his screen by the way. Adomante, you can stop sharing.
Okay.
Good. Good morning, everybody. I hope you are doing well. Yeah. So basically, a few years ago, when I came in Ghana, we saw that there were a need of wellness services, basically, because there were a lot of, let's say, social issues we have seen in the country, which basically the link is all the lifestyle diseases. So it means it can be avoided, basically, which is a good news because if you know you have a disease which you cannot reverse, at least you can say you have a big problem. But if it can reverse, at least it's a good news. So I think let's take it in this positive note. So basically, what we have seen were the way people eat and exercise were not in the right way, which caused these non-communicable diseases, which are basically lifestyle diseases. Half of our population are obese. It's a fact today. And most of the time, when we work in companies or individuals, we see that most of people has to challenge with diabetes, hypertension, etc. All these are basically lifestyle diseases. And we can see that it's created a lot of issue for the nation because a healthy nation is a nation who can produce, create wealth and value. And a nation who is not healthy automatically can struggle much more. And this problem, excuse me, can be seen in company too, because it's bring a lot of productivity issue because a company wants efficient people, happier people who can make the difference in company and create wealth, value, basically. So we can see that these are a real issue for us. So in link of that, what you have done basically is you have created a global ecosystem, which name is My Health Corp. which has many components. The first component, is the school, and the idea of the school of iOS is to take all the personal sport and fitness trainers in the nation, give them a proper accreditation, then they can be certified. And if they are certified, they can use sport as a tool to make a difference. So this is what we create at the beginning to make sure that all our professionals are certified. And the chance they have is most of the school has certification, the dietitian, the physio, they have super school for that. But unfortunately for fitness, nothing exists yet. And we have created that school. And now it is possible for all personal sport and fitness trainers to be accredited and to be certified. And this is possible because of the lecturers, the teachers you have, which are fantastic and have done all these courses. But you have a lot of partnership like the Ministry of Sports, National Sport Authority, the Ministry of Health, because it's a social health issue too. We are trying to tackle it. As soon as most of professionals are certified, they can then use the My Health Corp Pro, which works like, let's say, Bolt or Uber system. They can download the app, which is today in Play Store or in Android Play Store or App Store, and they can create in few clicks, create their activity. And in the other hand, every client, every customer can use his own application, which also is in Play Store and Apple Store, and they can book basically any professional they want. So you can come in their house, you can come in their office, you can meet them everywhere they want to do an assessment, to know what is the problem, and then to put a real plan to reverse any trend they have. So this is possible because we have super solution around that based on technology basically. And the third thing we did basically was to bring the same solution for companies. So we have the My Health Corp for corporate, which idea is to engage corporate institutions to have a better health and to be much more efficient at work. So this also is possible and it is already done in most of companies in Accra we work with. But the challenge we had in the market was basically this solution is so that it was meant for very few. When I say very few, approximately 15% of the nation because of cost. When I say cost, today, if you book a dietitian, a basic cost you may have for a booking, a one session booking is around 350 Ghana cedis, which is, we can say, cheap in Europe, but quite expensive in Ghana and in Africa. So we try to create two solutions. The first one is the foundation, which is helping us today to have even the lecturing or even the talk we have just after is funded by the My Health Corp Foundation, which does basically social activity at no cost. How we do it? Each time you book us, part of the income goes in the foundation account to make sure that people can have a free access to our services without always booking. This is what I call basically the mission-led company. A company who understands the social issue and at the same time try to bring something positive to resolve that problem or that issue. And the last thing we did around that topic was to automate many things, and we are starting with the physical activity to make sure that everybody can have everywhere, anytime, wherever you want, based on what you need, an AI personal trainer. So basically, imagine that you have a fitness coach in your pocket, and you can use that fitness coach anytime you want, like you want. Basically, you do an assessment. After the assessment, the AI give you all the exercise you need to do, which can be in the form of program, workout, shorter exercise, or challenge, connect your family, your friends, etc. And this is possible in My Health Corp Fitness AI. You just need to have a basic subscription, which is less than 100 Ghana cedi, and you have a monthly subscription, like you have a personal trainer directly in your pocket, and you can use it wherever you want, wherever you are, without having any big issue. This is possible because we have a tech team for that, and we're able, based on the challenges you have in Ghana here, to build that solution to make physical activity, sport, exercise much easier accessible by just having a phone and a connection online. You take your subscription and you can do exercise like you have a real coach in your pocket. And you see at the end of the talk, we show you a demo because it's a real coaching based on your goals and based on your progress. Then we can help you to reach your optimum level of wellness. And the last thing I wanted to say and to do was to thank all the partners we have since inception who are helping us also to make this possible, basically, because they also fund us. They also give us trust to be able to bring at no cost also this type of activity for everybody. So thank you very much. And I think we give the floor to Dr. Kelvin Tete Augulu, who will take the lead to move to the next step. Thank you very much. If you have no question, let's move to the most important topic of the day, which is the heart talk.
Thank you very much, Kwesi Tebri, for the insightful presentation. So I welcome on board Dr. Kelvin Tete Ahulu to lead today's webinar for us. Hello, Doctor. Good morning.
Hi, good morning.
I believe I'm audible enough.
Yes, I can hear you. Can you also hear me?
Yes, please, I can.
Okay, that's great.
Okay. Kindly take us to today's presentation.
Okay, so good morning, everyone. I'm Kelvin Tetahulu. Today we'll be talking basically about prostate cancer. What we want to do today is for us to get an understanding of what prostate cancer is, and for us to also create an awareness about prostate cancer. Then this is a condition that is the leading cancer in men in Ghana and the second leading cancer in men in the world in general. So getting an awareness of this would really help us to make sure that we do not present late, which is what we normally have in Ghana. 60% of patients who are dealing with prostate cancer present very late to the hospitals within Ghana. And we want to curb that. And that's why we are having this conversation with the help of my health corp. Could we move on, please? All right. So what we need to know today is basically that, as I stated, prostate cancer is one of the most common cancers in men, but it's often treatable if caught early. So what does that mean? It basically means that if you come early, as we are creating this awareness, and you do come and you screen regularly, yearly, and we pick up this prostate cancer, the interventions available would help us to be able to prevent you from dying of prostate cancer. In the West currently, there are a lot of people that actually live and die with prostate cancer, but not die of prostate cancer. And that's where we want to get to in Ghana. In Ghana now, most people are dying of prostate cancer, which is really unnecessary. This is because, as I stated, they present very late stage where the cancer has really advanced and has spread to other places, which we call metastasis. So the awareness, as I said, can save lives through early detection and informed choices. Yes. Can we move to the next slide, please? So what is the prostate? The diagram has been changed. I wish there was a particular diagram I really wanted to use to explain to you. So the prostate is originating from a Greek word, which means prostatis. This prostatis, the pro means before and status means to stand. So basically, if you look at the anatomy of the human body, you would notice that the prostate is right in front of the bladder. And the early anatomists did not really know what the function of the prostate was. So they just named it prostatis, and which has later been assimilated into the English language as prostate. So it basically means standing in front of the bladder, basically. So it's a walnut size shape. If you know what a walnut, very small, very, very small. That's how small the prostate is. And it's located in front of their bladder and also in front of the rectum. That is why when you go to the doctor, sometimes when we glove our fingers, we can put it inside your anus through the rectum, and we are able to examine the prostate. Yes. So its job is to produce a fluid that nourishes the sperm. Or yeah. So men, when we ejaculate, that is when we come. What normally comes out is the semen, not the sperm. So the sperm with certain fluids, and these fluids are mainly made up of what we call the PSA, prostate specific antigen. So this prostate specific antigen is abundant in our semen. And when what they do is basically they are going to give this sperm the nourishment and also the medium to be able to swim. Because as you come, normally, if it's true sex, you are going to come into the vagina, and this has to swim through the vagina into the womb or the uterus of the female, and then fertilize the egg at the fallopian tube. So without this medium of this seminal fluids, the sperm will not be able to do what it's supposed to do. Do you understand? So the prostate specific antigen is one of the main components in your seminal fluid or in your semen that helps the sperm to do what's supposed to do. So we'll move on to talk about what the prostate cancer actually is. So one thing you need to know is your ears grow with you. If you look at any baby, their ears do not remain the same, but it grows with them as they grow. The same with the prostate. For men, the prostate grows as we grow. And this is how come prostate cancer cells are able to be formed. What you need to understand by that is every time the prostate is growing, it doesn't mean it's increasing in size. It means the cells and cells are dying off and new cells are being produced. And whenever growth is occurring, there is a variation. There are new things being formed, new types of cells. And when these new types of cells are formed, there could be what we call genetic error or genetic mutations. So the accumulation of these errors can lead to the formation of what? These cancerous cells within your prostate. Okay. Post-mortem that was done of men between the age of 50 and 80 found out that 14% of men between the age of 50 had prostate cancer cells. Okay. And 80% of the men of 80 of the age 80 had prostate cancer cells within them. So this basically gets to show us that what prostate cancer cells is at a higher age as there are more cancer cells within the prostate as you grow. So the prostate grows with us. So the prostate cancer cells could be slow growing or it could be basically aggressive. Unfortunately for us within our setting, because of some genetic mutations, the kind of prostate cancer that we develop are mostly the aggressive type. Not all prostate cancers need treatment, which is true. Some just need to be monitored very closely. And as we go, I would explain why some don't need treatment. Okay. So we go on to the risk factors that might lead to you having a prostate cancer. Yes. So there are things that we can change, which we call the modifiable risk factors. And there are things we cannot change, which are non-modifiable. Okay. So non-modifiable risk factors are the age. As you grow, you cannot change your age. You can go for plastic surgery and look younger, but your age still remains the same, basically. So the risk of prostate cancer increases with age. So from the age of 50 going, your probability of producing cancerous cells within your prostate is high. And as you age above 50, it gets higher than that. Another non-modifiable risk factor is the fact that if you have a first-degree relative who has had or who has been diagnosed of prostate cancer, so who has had, maybe they were not diagnosed and you don't know about it, so probably you wouldn't know. But those who have been diagnosed, who you know, then there's a certainty, it doubles your risk. So when I talk about first-degree relative, I'm basically referring to your nuclear family. So your father, your brother, if they've been diagnosed of prostate cancer, then the likelihood of you having this cancer is high. Okay. Another factor which I didn't put here is being a male. So being a male basically means you have the XY chromosome. Now we live in an era where we have transgender and all these other LGBTQ factors going on. But if you are a female and you become a male, rarely would they put a prostate in you. Females do not have a prostate. So anyone with the XY gene, so you can change your gender and become a male, but you wouldn't have the genes, the XY genes, basically. So anyone who is a male is at risk of possibly becoming or having a prostate cancer. Another thing which we cannot change is our ethnicity, we being blacks or Africans. So it is found out that Africans have a higher risk or higher possibility of having a prostate cancer as compared to Asian men. The research showed that 170 out of 100,000 men who are Africans have a possibility of having prostate cancer. In the Caucasians, those are the whites, 132 out of 100,000. However, in the Asians, 28 out of 100,000 have the possibility of getting this prostate cancer. Lifestyle, which is a modifiable risk factor, things we can change. So, sedentary lifestyle is a higher risk of you having a prostate cancer. Having a diet which is higher, very high in red meat, okay, and low vegetable risk factor. These also shows that when we Africans, especially in our diet, you realize that we eat very low vegetables and we have very high content of red meat and carbohydrate. And now, rarely do we want to exercise. We normally have this sedentary lifestyle. So this is where my health corp comes in to help us with their new AI, which later will be shown to us. And this is going to help you to alleviate you or reduce the sedentary lifestyle, and going to help us with this activeness, which is going to help prevent or reduce the risk of us getting prostate cancer. So normally, early prostate cancer shows no symptoms. It means you wouldn't have any problem. You wouldn't be having any back pain. You wouldn't be having any urinary, or when you're going to pee, let me use that word, you wouldn't have any problems. But the late signs, so when you start experiencing these late signs, that means where you have come to is probably in an advanced stage, okay? So this, when you're going to urinate, you would have to push or strain to urinate. You remember when we were young, when we were peeing, we could challenge ourselves to see who could pee the farthest. Now, when you pee, the urine flow is very low. You see blood in your urine, which we call, or even in your semen, okay? There will be lower back pain. There will be hip pain, thigh pain, even erectile dysfunction. These are some of the late signs of possibly you having a prostate cancer, but they are not synonymous with just prostate cancer. So if you have those symptoms, do not just assume that, oh yeah, I might be having a prostate cancer, or I have prostate. Yes, you might be having, but you do not have prostate cancer. You visit your hospital, the closest hospital nearby, or if you have your GP, you visit, or your primary care physician, you visit them, and you will be assessed, and then you will know if you do have or not. And some of these symptoms can be caused by non-cancerous issues. So within the prostate, when you have something we call an enlarged prostate, which we call BPH, benign prostatic hyperplasia, this can cause you to have some pressure effects within the tube that lets you pee. And this could cause the problems that we are having, the late signs, like the trouble urinating, the weak urine flow, and even sometimes the blood within the urine. Okay? Please, the next slide. So if you didn't take anything from this talk today, is please take away the screening and detection points, because these are very important. And this is why one of the main reasons why we are talking about prostate cancer today. So whenever you, as an adult or a male, and you get to the age of 40, that is the ideal time for you to start screening for prostate cancer. I know we've written 50 here, the WHO recommends 50, and in people who have like first degree relative who have been diagnosed with prostate cancer, which doubles their risk of them having this prostate cancer, they start at 45. But I would advise that at age 40, you can actually start screening for prostate cancer. The reason being, as I stated, in Africans, we have a higher risk of having this prostate cancer, and due to our genetic modifications and our lifestyle. So starting at an earlier age would prevent you from developing or discovering this at a later stage, and especially because we also have the aggressive type of the prostate cancer. So what do we do when we go for the screening? So screening, you can just enter into any laboratory or go to any facility, and please can you go back and recommend that you have a prostate-specific antigen test done. What it's done is basically you go to the lab, blood is taken from somewhere like the normal blood samples you normally take for your full blood count, your liver function test, or your kidney function test. The same procedure. This blood is taken and is analyzed to see if your PSA levels are high or low. As I stated earlier, I talked about the PSA being within the semen, which is normal. So if I take any male semen and I check for the PSA level, it will be high. It doesn't mean you have a prostate cancer. But what you need to know is that whenever there is any abnormality or any cancerous cells or any irritation of the prostate, some of these PSA would seep into the blood, and that is what we are measuring by doing the serum PSA test. So some of these seeps into your blood, and these are the ones that we check for. So if we check in the blood and the PSA level is higher than normal, then we can say, okay, you might be dealing with a prostate cancer. But it's a screening test. So screening means basically, let's say you go to a function or you go to a club and there's a bouncer there, right? The bouncer would be able, when you come, they pat you, check. But sometimes, when people who have weapons or whatever, they give it to the females and the females put it in their bra, which is not thoroughly, checked by the bouncer, because most bouncers are males. So the screening, so these bouncers will be able to determine most harmful things that will enter the club or the function, but not all the harmful things, because some people can sneak some in. The same with the screening test. The screening test is not an absolute 100% that, okay, you check your screening test and everything is normal, doesn't mean you are dealing with it. Or you check and everything is high, means you are dealing with it. There are, as I said, there are a lot of factors, and these are the false positives and false negatives, which we'll talk about later. So the screening isn't perfect, but it helps us to be able to determine most people who might in the future actually be dealing with prostate cancer. Okay. Then the other thing your doctor will do is what we call a digital rectal examination. I'm not sure if most of you have been through that. So basically, you go to the hospital, your doctor will tell you to lie down on the bed on your lateral side or on your side. You fold yourself up like a baby. You pull your shorts and your boxers down. Your doctor will then glove their finger, and with a gel, they'll put their finger into your anus. This normally is done for males, okay? And when the finger gets into your anus, it's going to assess the prostate to see if there are any lumps and bumps within the prostate. And if there are lumps or bumps, this shows us if you are dealing with prostate cancer or not. But as I said, it's a screening, which is not perfect. So from there, we will do other tests that would help us to actually determine, are you dealing with the prostate cancer or not? So now let's go to the false positive. What I mean by false positive are, these are things that might tell you, okay, this person has a prostate cancer, or this person prostate the PSA levels are high. But then it's giving you this false impression that the PSA levels are high and you have prostate cancer, but you're actually not. Then the false negatives are things that make you feel like the PSA levels are low, but in actual sense, they might be high. Okay, so the next slide will show us that some of these false positives we are talking about is the earlier one I talked about, the benign prostatic hyperplasia. It's one of the false positives. Can we move to the next slide, please? Yes. So the benign prostatic hyperplasia is one of the false positives. This is an enlargement of the prostate cells. It's not the changing of the cells into cancerous, but the prostate in itself, which is a walnut size, becomes enlarged. And when it becomes enlarged, as I stated, some of the PSA will seep into the blood and your PSA levels will go high. So it might give us a false positive that probably you are dealing with a cancer, but actually you're not. Any infection would cause the PSA levels to seep from the prostate into the blood. Okay, so prostatitis. So basically, the prostate that has an infection. So itis is infection in medicine. So prostatitis, prostate and infection, that can prostatitis. These urinary tract infection, if you are dealing with pneumonia, if you are dealing with an upper respiratory tract infection like tonsillitis, if you're dealing with any sort of infection at all, even malaria and all those things, they can cause your PSA levels to go high. So we deem everyone, or we plead with everyone, if you know you are dealing with any infection, please wait for it to be subsidized, for you to be totally cured before you have your PSA test done. Because if you are having these things and you check your PSA levels, they might be high. So make sure you are not dealing with any infection before you check for your PSA levels, before you check your PSA levels. Another thing is ejaculation. So some people confuse erection from ejaculation. Erection, I'll be a bit vulgar here, excuse my friend. So erection is when you get hard, okay? And ejaculation is when you come. So when you come and you see your semen, or what you call the sperm, comes out, that's when you have ejaculated. So before any prostate specific test is done, any PSA test is done, make sure that you have given yourself minimum of 2 days without ejaculation. So ejaculation is not just through sex. Masturbation can also cause you to ejaculate, okay? So 2 days without ejaculation before the PSA levels are checked, and then we get the accurate PSA levels. Cycling is not just someone who just rides the bicycle once a day, but people who are avid cyclists, people who go to the gym and are on the the stationary cycles for a very long time, and they do that. That's like their go-to exercise. These people, because the seats are narrow and it's going to hit into your crotch, it's going to irritate the prostate and will cause your PSA to seep into your blood and might cause your PSA levels to go high. So you make sure that you avoid cycling for at least a month before your PSA levels are checked. Other things are hormone therapy. So people who are on hormone therapy, most of the men would want to build muscles. Yes, and they use this testosterone hormone injections to build their muscles. One thing you also know, which I forgot to highlight to you, is that the prostate grows on the effect, or the catalyst for that is the testosterone, which is the male hormone. So if your testosterone levels are high, or if the hormones are in that or are present in a higher level, they are going to cause your PSA to go high. So anyone who is on these testosterone injections or hormone therapy needs to avoid it at least 2 months, 1 month to 2 months before they get their PSA levels checked. The only thing on this list that causes false negative are certain drugs. We talked about the benign prostatic hyperplasia. That's the enlargement of the prostate. So when your prostate enlarges, we give you certain medications which are going to help the shrinking of this prostate and help you to pee without any restriction. Some of these medications are finasteride, silvestrol, and these medications are able to give us this false negative because they help to reduce the PSA levels. So your PSA levels, when you check, when you're on this medication, will look like, oh, you have a low PSA levels, everything is fine, but you could be actually dealing with prostate cancer. So you have to go off this medication for a certain period of time before you check for your PSA levels. Then the digital rectal examination, whenever any doctor puts their hand into your anus and they are touching and feeling your prostate, it's also affected because you see we are irritating the prostate by touching it. So these things need to be at least 2 days after any digital rectal exam before you can do your PSA levels. So if you do your PSA level, if you do a digital rectal exam maybe today and the doctor requests for a PSA level, you should know that at least 2 days after that before you go and do your PSA levels. Then biopsy. Biopsy is actually when we put an instrument into the prostate and then we take some tissues of the prostate to go and check with the pathologist to see if, okay, are these prostate cells or not. So when we do that, you need to, because we've irritated the prostate, you need to avoid at least 5 days before you check for your PSA levels. Okay. The next slide, please. Mr. Adomante, yes. So diagnosing and staging. So after we done the screening, and those who have the higher levels of the prostate specific antigen, we end up doing other external or other extensive tests to be able to determine if this person actually has prostate cancer or not. So the first thing we normally do, the new thing we normally do, is we do an MRI scan. So the MRI will help to delineate the prostate and be able to tell us exactly where the cells, the cancerous cells are. After that, then we do what we call the biopsy. So with the aid of the MRI, we are able to determine exactly where we can take the biopsy from. And those cells are put under a microscope by the pathologist, and then they determine, okay, is this really a cancerous cells or not? And we are able to, okay, this person has a prostate cancer or not. Then after that, after we've determined, okay, you have a prostate cancer, we have to stage the cancer because every cancer has to be staged. The reason being, cancer can move from where it is its original source to other places, and those are the advanced cancer. So is the cancer just localized to the prostate, or has the cancer spread, which is metastasis or the advanced stage of the cancer? So depending on each stage of the cancer, then we will know how to treat the patient. Okay, yes. So staging helps to know how to treat the patient, and not just the staging, also the habitus of the patient, or the how you, the patient, actually look. Your age will be a factor, and if you are dealing with other medical conditions, other comorbidities, will also help us determine how to manage you. Okay, can we move to the next slide? So treatment options. So in the elderly, mostly at the age of 80, and so this person has been screening himself every time, we've not noticed any prostate cancer cell. Then maybe at the age of 80, we check and this person has prostate cancer cells. This person would normally go under active surveillance, because at the age of 80, we assume or we postulate that you have about 10 to 20 years more to live, and there will be no need doing any aggressive treatment on these patients, okay, to take out, especially if it's localized just to the prostate. We rather want to monitor you and see how things progress. Yes, because normally at the age of 80, they are dealing with other comorbidity, other medical conditions, and if we rush into, doing these surgeries for them or treating it aggressively, we might even the treatment we are going to offer might end up causing their demise more than the prostate cancer they're dealing with. So we have to just do active surveillance and monitoring of these patients. But then in a patient who has like a first degree relative who has been diagnosed of prostate cancer, and they come in for screening and we realize, okay, these are prostate cancer cells. We do our biopsy, we do our staging, and it's just localized to the prostate. What we'll do immediately is to take out the prostate, okay? And that's what we call prostatectomy. So we remove the prostate out, okay? Other methods we can do is, whenever we look at someone who has an advanced stage of the cancer, we might end up doing what we call radiation therapy, or sometimes it's difficult to us to access these prostate cancer cells. We might end up doing radiation, so we give rays to the prostate, and this reduces the size of the cancerous cells before we go in and take it out. We can also do hormone therapy. So as I said, the testosterone is the one that increases the growth of the prostate. So what we can do in advanced stages is we can either take out the testis, because the testis that produces the testosterone. So we are legally castrating the patient. So we take out the prostate in advanced stages, okay, not when it's just localized. In advanced, where like these prostate cancer cells can be found in the lungs of the patient, can be found within the backbones of the patient, the hip of the patient. We can't go out taking someone's lungs. So what do? We are going to do hormone therapy. So we take out the testis, and when we take out the testis, there's no production of testosterone, and this person, it reduces the spread of the cancer and reduces their pain and all that. Or we can just give them anti-testosterons that would reduce them the testosterone levels within their body. Okay, we can also do chemotherapy. So chemotherapy is we give a medication, and this medication goes into, so there are these cancer pills that go into the system, and then they try and counteract every cancer cell that they might meet. So this is more of a systemic medication. And please, next slide. Yes. So as I stated, the choice depends on your age, your health status, and the cancer stage. And also you having a conversation with your urologist. So urologists are doctors that deal with the male reproductive system, okay, which the prostate cancer is actually reproductive and urinary system, which the prostate is actually part of. So it's not just a one option for everyone, but we tailor it based on individual preferences and what is available to us within that facility. Yes. Next slide, please. So the side effects of the treatment. So the treatment, everything we know in this world comes with a side effects. That same way the treatment will come with certain side effects. The treatment, if you are a young man and we take out the prostate, especially in the localized form of the prostate cancer, this can lead to you not being able to give birth again because, as I stated, the sperm will not even be produced because when we are taking out the prostate, we take out some ejaculatory nerves and all that around the prostate. So when we take out those things, it makes it impossible for you to be able to even ejaculate anymore. So what we normally advise is if it's a young male who doesn't have his complete family yet and has wishes of having his own children, what we do is we ask them to store their sperms within a bank before the procedure is done, or even the chemotherapy or even the radiotherapy, because all those things will affect your sperm quality or your semen quality. So you go to this, most of these fertility facilities in Ghana actually have the sperm banks where you can go and store your sperm before the procedure is done. Then afterwards, if you have your soulmate now and you want to, those sperms, your own sperm is taken to do an IVF for your partner, and then you can have your own child. Okay. So it can lead to urinary issues. So most of them would have catheters. So we put a tube, a rubber tube in them, which we call a catheter, for some time period till they are able to gain and regain their bladder control. Yes. It can also lead to fatigue. So there are support systems available. There are medications that can also help with the erectile dysfunction. We have the tadalafil, sildenafil available. Now we even have pineal prosthesis. So in advanced stages where the medications are not working, we can put a prosthetic penis to help with your erectile problems, and it helps you function properly and do as you want. Yes. Also, lifestyle changes can also help. Counseling. So we do counseling before and after. Counseling before, during, and after. Because if you don't counsel the patient before you go and do these things, they would have problems. So normally you would have a psychologist having a talk with you before we even start the whole procedure. Okay. What you need to know is many men live long, fulfilling lives even after the treatment. So do not hesitate to visit or have this cure done for you. Most people are very hesitant about it because probably they've heard one or two things from other people. And yes, you might hear all these things out there, but it's best to just have a talk with a physician, a urologist, and all your worries, just ask them, and any question you have, ask them and let them be able to explain things to you. What you don't understand, probe further into it, do your own research before you make the decision not to go for the treatment. Okay. Next slide, please. So prevention, we talked, if you remember the risk factors, we talked about the modifiable and non-modifiable. So now the prevention will normally focus on the modifiable risk factors. So what do we know? We know that eating of lycopene and selenium normally helps to reduce the risk factor or prevent prostate cancer. Yes. So where would you get this lycopene and selenium? You get them from your vegetables, you get them from your whole grain, your nuts, you get them from your fruits. So we encourage eating more fruits, eating more vegetables and whole grains. We also encourage staying active with regular exercise. The World Health Organization recommends 150 to 300 minutes of moderate intensity exercise, which is like brisk walking. Yeah. And then they recommend between 60 to 150 minutes of rigorous intensity. That's swimming with laps, running. Yes. So if you look at that, My Health Corp has really inculcated that into their plan, and this is really going to help you to reduce your risk factor or your risk of getting prostate cancer as an African man or as a Ghanaian. Yes, you have to maintain a healthy weight. As you said from the earlier videos we watched, you realize that they have a nutritionist who would help you to maintain a good BMI and a good waist circumferences. These are some of the things that would help us to be able to determine if you're obese or not. So obesity is one of the risk factors that can lead to prostate cancer. So you have to work on all these things. regular checkups are key for early detection. So as I stated, if you're at the age of 40, every year, you can visit any laboratory, get it done, and then you take your results to your physician to explain to you, or you just go to your physician, let him assess you, let him have your PSA test level done, okay? Yes, and these things are going to really help you to prevent and to early detect that, okay, you have prostate cancer, and the less aggressive forms of treatment can be offered to you, and you'll be fine, and you will live a fulfilling lifestyle, okay? Next slide. So, as I stated, why awareness matters. Early detection improves the outcome. So 98% survival rate for localized prostate cancer. So this is a prostate cancer that hasn't moved anywhere apart from it being within the confines of the prostate. There's a 98% survival chance rate if this is determined early. Men, normally, we do not like to share our problems, but in these, we really have to, share our concerns. And in the females here, please try to talk to your male relatives, because I know females are very supportive, and men, we also try to be supportive to each other, and let's not just play jest with most of these things. I know we tell, when a fellow male tells you something, you just take it as, we jest around, we mock around with it, and we do not really take it, but this is our own health. This deals with men, and if we do not help ourselves, the women can do very little, so we need to help ourselves. There's also research and advocacy going on. If you've been diagnosed with prostate cancer, I would urge you to, be part of those who advocate for it. And also, if you could help and render yourself for research, because most of these information we have currently was because people rendered themselves for research. We Ghanaians, Africans in general, do not really like going into research or using ourselves for research. But if we do, then we can tailor our treatment plans, and we can tailor our preventive measures to ourselves, because most of this information we are even getting is from the West and not really information generated by ourselves. And we need information generated by ourselves to be able to tailor our treatments to ourselves. Do you get me? Yes. Can we move on to the next slide, please? Yes, so we've come to the end of our talk. One thing I would like to also on, there is one famous Ghanaian. Before anyone asks the question, I hope you can tell me who died of prostate cancer. He's a very, very famous Ghanaian, and it is said he died of prostate cancer. So if anyone could tell me, I'll be glad, and then we can continue with our questions. Thank you so much.
Thank you so much, Dr. Kelvin, for the insightful presentation. So I would open the floor for questions. You can either drop your question in the chat box, or you can raise your hands. I would call you, then you can ask your question. So the floor is opened. Apia Richmond Ankara, I see your hand up. Please ask your question.
Okay. Good morning, Doc.
Good morning.
Yes. Please, my question is, sorry, I joined late. I don't know whether you discussed about it, but my question is that I want to know the age that a man can be detect that he has a prostate cancer. Thank you.
Okay. Thank you for your question. It's a very important question. So basically, as I stated earlier, which you said you were not part of, prostate cancer cells, and from postmortem that was done, show that at the age of 50, 14% of men who had died, so postmortem is people who have died, 14% of them had prostate cancer cells, those who were 50. And those who were 80% of them. So it shows that as you age, the prostate cancer cells increase within you. I wouldn't put any specific age, but I would say at the age of 40, please do try testing for your PSA levels, and that will be able to help us to screen to see, okay, do you have prostate cancer cells, and then we can do further tests to see what you are actually dealing with. Okay.
Okay. Doctor, from the chat box, I see interesting feedbacks. For to the
Okay.
question you asked, the
Yeah.
famous musician who died of cancer, prostate cancer, I see Boatin saying it was Dada KD. I don't know if you can confirm that for us.
Okay, so the answer is actually our first president, Dr. Kwame Nkrumah, Sajifo Dr. Kwame Nkrumah.
Okay.
He died of prostate cancer.
Okay, so Samuel also said it's proposed that Dr. Kwame Nkrumah
Yes,
died of prostate cancer.
yes, it is proposed. Others said he was poisoned, but the medical records on the ground that we have says that he died of prostate cancer.
Interesting.
So it should just let us know that it's something that is just here. We know no one will say they don't know Dr. Kwame Nkrumah. So yes, it should let us know that any one of us could get it. So let's just start the screening and let's start avoiding the sedentary lifestyle and let's start eating healthy, avoiding the high red meat and also eating lots of fruits, vegetables, whole grains, and also exercising as recommended by the WHO.
Right. So from Sandra Minta, she's asking a question. Can a man have sex normally after being diagnosed with prostate cancer, knowing that he may have a weak sperm cell?
Okay. So thank you, Sandra, for this question. Very, very interesting. So what I want you to know is if you've been diagnosed of prostate cancer, as I stated, also, so I think I didn't really hit it well. Most men can die with prostate cancer than die of prostate cancer. That is most men. I'm not talking about Africa. I'm talking about most men. In Africa, 60% die of prostate cancer if they are diagnosed of it. But most men in the world can die with prostate cancer instead of dying of prostate cancer. If you are diagnosed of prostate cancer, it doesn't mean that your sperm becomes weak. As I said, the procedure that will do the treatment can end up causing you to have what weak sperm cells. So you might have problems not having your normal coitus, your normal sex would be quite detrimental. Do you understand? But then, as I said, we also have ways to manage that. But if you are just diagnosed with prostate cancer and it's not the advanced stage, because in advanced stage, you'll be having low back pain, you'll be having hip pain, you'll be having thigh pain. Those people will not even be able to engage in sex at all. So it's not about the weak sperm cells. Sex is different from weak sperm cells. You can have sex, but probably there are men who have sex but are not able to fertilize a woman. Do you understand? So weak sperm cells do not equate to not having good sex. Some men can have they are the best in bed and whatnot, but are not able to impregnate a woman. So weak sperm cells are different from having good sex.
Right.
I
Sandra,
hope this answers your question, Sandra.
yes, I was just about asking her. Okay, okay. You're welcome, Sandra. The floor is still open for more questions. You can raise your hands or you can drop your question in the chat box. Apia, I still see your hand up. You want to ask a question again or you are okay?
Please, I'm okay. Sorry.
All right, sure. More questions, please.
If there are no questions, I will throw a question to you guys to make sure. So in the screening test, what are the two things that can be done? If anyone could answer that. I know it's not a teaching session, it's not a lecture session, but at least it will help me to know that, okay, people have listened and people understand.
Yes. So, Doc, please ask your question again. Okay,
So
but
I was
before
saying,
you proceed with your question,
all
I
right.
see two hands up. Enoch Kweku, Barima, please, if you can hear me, kindly ask your question.
Okay, so I want doctor to clarify if it is true or it's just a myth. Eating of tomatoes, the raw tomatoes or cooked one, does it contribute to a healthy prostate?
Okay.
Does it contribute to what?
A healthy
Healthy.
prostate.
Yes. So thank you, Enoch, for this question. This is absolutely true. The reason being, you remember I mentioned two
Lycopene.
yes.
Lycopene.
So lycopene is found in tomatoes. So that's why we would advise people to take in a lot of fruits, which tomato is, and that would also help to give you a good health within your prostate, or help prevent the risks of you developing prostate cancer cells. Yes. The other thing is also selenium, and selenium you can find in nuts. So as I said, the prostate is like a walnut, so any nut helps it to have a good health.
Right. I believe his question is answered. Okay. Samuel Ejekum Dakwa. Please, I see your hand up.
Yes, thank you very much. Please,
Thank
may
you.
I know, or is it true that, are you hearing me?
Yes, please, I
we
can hear
You
you
hear
perfectly,
me?
Mr. Samuel.
Hello.
Yes, Mr.
Yes.
Samuel,
Yeah, Mr. Samuel, we
Yeah,
can hear
is
you.
it true that regular sex? Yeah, I'm talking. Is it true that regular sex, or regular ejaculation can reduce the risk of prostate cancer?
Okay, Doc, before you answer his
Hello.
question, Sandra also asked a similar question. Can consistent or good sex life reduce a man's chance of getting prostate cancer in any way? So you can combine these two questions and answer them.
Okay, thank you, Mr. Samuel
And
and
I have a
Mr.
second question.
Okay,
I have a second question.
okay.
Hello.
Yes, please, Mr. Samuel, we can hear you.
If you are diagnosed of enlarged prostate, there's a name for it, like the benign cancer, a cancer which is
The
not
BPH.
dangerous. The
Yeah.
BPH. Yes. What is
Yes.
the way out? I mean, how can it be avoided or treated? So,
Okay.
thank you.
Okay. Very insightful questions, Mr. Samuel. So I'll take it from the first question. So yes, there is a study that actually backs the fact that ejaculating 21 times a month for a male actually aids with reducing the risk of prostate cancer. So there's actually a study that supports that. Okay. However, there's also a research that says that whenever men start to have sexual intercourse at an early age or have multiple sexual partners, they have a risk of developing this virus or sexually transmitted disease, especially herpes simplex virus. And this herpes simplex virus is noted to also increase the risk factor of prostate cancer. Okay, so yes, you can have your 21 times ejaculation per month, which would help prevent you from developing prostate cancer. You're absolutely right, because the research backs it. But then it should be with just a single partner, not multiple sexual partners. Because if you're having multiple sexual partners and you end up getting the herpes simplex virus, then you increase your risk of also developing the prostate cancer. I hope I've answered you, Mr. Samuel and Miss Sandra. Then coming to yours. Yes, coming to your second question. So BPH, which is a benign prostatic hyperplasia, is an enlarged prostate, basically. So when the prostate is enlarged, what happens is, Mr. Ado, can you go to the first, I think the second or third slide? I would want to show them something. Keep going, keep going, keep going. Keep going, keep going. Yeah. So if you look, it's not quite well defined, but I wish if the yellow thing there, is the prostate, right? And in between, there is a tube that passes in between that, and that tube is what you pee through. That tube is known as the urethra. Okay. So if the prostate is surrounding the urethra and the prostate gets big, it means what? It's going to constrict or impede this urethra. And that's where you'll be those who have the benign prostatic hyperplasia, the enlarged prostate, they have the urinary problems. You know, the when they are peeing, it's either dividing into two, they have to strain or push for the urine to come out. They pee very often at night, like 4 times at night before they wake up. They sometimes when they feel the urge to pee, they can't hold it in. If they don't rush, they pee on themselves and all those other symptoms. Yes, so how to manage that depends on how advanced or depends on your health. Normally, we start by giving medication. So we have what we call tamsulosin, we have finasteride, and these medications will help ease and open up the tube so that you are able to pee frequently. If you're able to pee freely, when even though the prostate is big, we wouldn't have a problem. The other option is when we can take some part of the prostate out. So we take some part of the prostate to help relieve the tube so that you can pee without any problem. The other thing is we can also take out the whole prostate. So there are very various management of ways of managing this BPH, but it's all dependent on an individual basis. So I can say for you, go and do this, for you, go and do that. Until I see you, until I have a personal chat with you, until you and I come to a consensus, and then we see the pros and cons of each treatment, then we can make a way forward on how to manage it. I hope this answers you, Mr. Samuel.
Yes, no, but this baffles me a bit. When the process is enlarged, it's supposedly constricts the urethra, whatever, isn't it? So I expect
Yes, please.
I expect it to cause difficulty in urination. I expect it to cause difficulty in urination because of the constriction, rather than frequent urination, uncontrolled urination. I need explanation to that. And secondly, I've been hearing of some physical exercises that
Hello.
can reduce the size of the prostate. How far are my claims true?
So I had the first question, but then the second one I couldn't get you. So let me answer the first one, then you come with the second question again.
One is
that okay, Mr. Samuel?
Okay.
Okay.
Right.
Okay. So the first one. So what happens is, you see, when this tube is impeded, what happens is the patient will pee, but doesn't pee fully. So your bladder normally can contain the urine pouch that stores the urine, can contain about 400 to 600 ml of urine before you feel the urge to pee. With these people, the bladder fills up, they feel the urge to pee, but because they are pushing and they are struggling, when they pee small, there's a bit of relief, because if you get to like, if you have 600 and I'm able to pee like maybe 50 or 100 out, I wouldn't feel the urge to pee again. So when they pee small, they feel they're okay, because the force with which they are even peeing, it's quite, it's stressful. So I've peed once, I think I'm okay. So what they don't finish everything, then they go and sit down. But then the bladder will fill up easily again, because what? 600, you just took out 100, it's left with 500. 100 will come and join, compared to if me, who doesn't have that problem, I've emptied everything. So it will take a long time for me to feel the urge to pee again. Do you get my point? So they don't empty their bladder completely because of the constriction.
Yes.
They pee a little and then they go and rest. Then they get the urge again, because it fills up again. So it's like the accumulation. Do you understand? So that's why there's frequency with urination when it comes to people who have the benign prostatic hyperplasia. Okay, so please, with your second question, if you're okay with that answer.
Yes. The second question is that I've been hearing of some physical exercises that can reduce the size.
Exactly, they're short notes.
Hello? Sorry. Mr. Domante, I don't know if you could hear, but I lost him, and
I'm also struggling to hear him as well. I don't know, Mr. Samuel. Can you please drop the question in the chat box?
probably the network connectivity at where it
Hello.
is.
Yes. So let's take the question from Mr. Andrews.
Okay.
Yeah, hello,
My
Doc.
question has not
Hello,
been answered.
everyone. Okay.
Hello.
Yes, hello. Please, am I audible?
Yes, please, you
Yes.
are.
Yeah.
Okay, great. So sorry, I couldn't join early because I was in a meeting at work. I had the opportunity to join when you were taking the Q&As. So there's been a debate about a myth that I think you cleared up here, but my colleague was still coming out of the meeting, so he didn't hear it. So he was of the opinion that if you have multiple sexual partners, it decreases your risk of having exposure to prostate cancer. And I think you said something otherwise by attributing it to early sex and then the HSV. So
Yeah.
I want you to, I've called him to come and join, and I want you to reiterate that for him so that at least he hears that maybe it is God's way of saving him today. So,
Oh, okay. All right. So, okay. Thank you for the question again, Ms. Andrews. So, as I was stating, I think Mr. Someone was the one who asked, and Miss Sandra. So, yes, there's a research that backs the fact that having 21 times ejaculation helps to prevent or reduce the risks of you having prostate cancer. There's a research that actually backs that. Yes. But then there is a research that also states that when men start to have sex at an early age or have multiple sexual partners, they end up contracting sexually transmitted diseases and infections. Actually, the one that has been found as the culprit so far is HSV, herpes simplex virus. Okay, and this herpes simplex virus is noted to double the risks of men getting prostate cancer. So yes, you can get your 21 times ejaculation if you are having one partner. But if you're having multiple sexual partners or you started having sex at an early age, then yeah, you increase your risk of getting prostate cancer. Yes. The early age, the factor was, normally at an early age, when men are having sex at an early age, they do not wear the barrier protection, no condoms, because if maybe you start having sex at the age of 15 or 14, rarely can you go to a pharmacy in Ghana because, Ghana, we are very judgmental to buy a condom. So normally you would be having raw sex. And if you're having raw sex, then yeah, there is a possibility that you might end up contracting these STIs, which will double your risk of having prostate cancer in the nearest future. So I
Right.
hope this helps your colleague.
I believe so.
Okay.
So let me take an interesting question from Samuel Inyan.
Okay.
He's saying, as we do for breast cancer, is there a particular month we set aside for prostate cancer awareness as well as free prostate cancer screening? Also, do you know of any hospital or centers organization who engage in that?
Okay. All right. So thank you so much for the question, Mr. Samuel. Yeah. So with prostate cancer, for women, we have the month of October. For men, we have the month of September. So in this year, the theme was basically early detection saves lives. So in the month of September, I think with my health corp, we had a presentation at KEK Brokers Insurance,
Yes,
and
you're
other
right.
organizations were also engaged in advocating and also creating awareness of prostate cancer. So every September is a month for prostate cancer, for men health, actually, prostate cancer. So it's a blue month. So you see a blue ribbon anywhere. Probably maybe you noticed it, but you didn't know they were talking about prostate cancer. Yes. So it shows that we are actually not doing our job and we need to put out more information out there. Worldwide also, some also have November, which is this month. So if you go on, there's a site called Movember. So M for men, then November, take the N out and put the M there. So Movember.com, which is a research or an educative platform for prostate cancer for men. In Ghana, almost every facility within the month of actually in the month of September offered free screening. I think my health corp also did some free screening for some people when in the month of September. So probably you could visit your nearby facility in the month of September, and you might end up getting free PSA test or a digital rectal examination done for you for prostate cancer awareness month.
Okay, I hope that answers his question somewhat. So I want us to take this last question from Boatin Ohene. Okay, Andrews is asking another question, but let me take that of Boatin's. Boatin is asking, are there cases where these symptoms you mentioned could be mistaken for prostate cancer?
Oh, so as I stated, what is that's a very good question. So when it comes to the diagnosis of prostate cancer, we do not use a one-off thing to say, okay, you have a prostate cancer or you do not have a prostate cancer. So we start with the screening. So we screen you using the data rectal examination or the PSA levels. As I stated, there are false positives and false negatives to these PSA levels and even the data rectal examination. So all those things have to be excluded. When they are excluded and there is nothing like that there, and then your PSA levels are high, then we go to doing the MRI scan. And the MRI scan would help us determine, okay, where exactly these prostate cancer cells are within the prostate, okay? Then after that, we will do, so it's like a triple therapy. So we are doing a screening, we are doing an MRI, then we do a biopsy. So the biopsy would help us to pick from, so normally now we are doing more of interventional radiology where there will be a scan at when we are doing the biopsy. So we are picking the where the MRI said the prostate cancer cells, we are picking those cells exactly, and we are looking at those cells. Back in the days, we didn't really do the MRI. What we did was just the PSA, and then we did the biopsy. And if I'm picking, how do you call it? Just a biopsy randomly from your prostate cell, from your prostate, I could pick the area where there are no prostate cancer cells. And that could end up with me misdiagnosing you that probably you do not have prostate cancer. Do you understand? But if you are picking exactly where the prostate cancer cells are, then rarely would we say, okay, these, because if you pick where they are and the pathologist looks under the microscope and sees the prostate cancer cells, when you diagnose, then you are really having prostate cancer cells. But if you are diagnosed and you have an opinion that, okay, probably this could be wrong or something, then you could get a second opinion. There's always a possibility for a second opinion. It's just that in our setting, I've noticed that most people do not know that they have the right for second opinion. You have the right for second opinion. You could visit another urologist in a different facility and have things worked up all over again to confirm. So if you have two people going through the same process and confirming you have prostate cancer, then you actually do. But then there is also a small caveat or small possibility of we having man error. And that's why we try to eliminate all those things by going through those 3 steps to make sure that whatever we are doing, we are certain of the diagnosis, because it's not easy for you to be diagnosed of cancer, and no one should just be out there just giving people cancer as a diagnosis. Okay.
Okay, right. So let me take this last question from Andrews, then we can end the session. Then we have the AI demo, then we close. So Andrews is asking, I wanted to find out if heredity or pertinent family history is one of the risk factors for prostate cancer.
Thank you for the question, Mr. Andrew. So yes, it is. If you could move the slide to that slide, so to that page. So yes, it is in one of the risk factors. Having a first degree relative, that is your nuclear family, your father, or your brother being diagnosed of prostate cancer doubles your risk. But as I stated, most men can live with prostate cancer without them even showing any symptoms, and they die a natural death. So probably your father has it or your brother has it, they passed on, and they were having a prostate cancer cells. You wouldn't know until you start screening. So yes, it doubles your risk of you having. So most men, prostate cancer is actually dear to me because one of my friends back when I was in, we were young back then in junior high school. His father died of it because he presented late to a hospital. And he's one of my very good friends. To date, we still interact and all those things. So whenever it's September, since I became a doctor, I get in touch with him. And with him, he actually took out his prostate and he has his sperm stored in a fertility center. He's not within the country, he's in the States. So yes, in Ghana too, you can, if you think your family has this risk factors within them and it doubles your risk and you do not want to go to the stage where you have a problem, you can just store your sperm, take out the prostate, and you can live your normal life without the fear of ever being diagnosed of having prostate cancer, or probably you forget about it and it's too late for you. Yes. So it increases. And when it comes to the genetic makeup of things, there's still studying ongoing on finding the specific genes that might be related to why we Africans have an aggressive form of prostate cancer. But studies are still ongoing. That's why I say if you have prostate cancer, you offer yourself for research to help we in Africa to also be able to, tailor things to our own environment. Yes.
Okay, thank you, doctor. Before you leave, please, your final words.
So I want to thank everyone, my health corp, for this opportunity to create this awareness. And my take home to everyone is just know that screening is available. It's not expensive if you visit any laboratory or any physician. And also note that my health corp has programs which will help you to be able to prevent this risk of developing prostate cancer and other non-communicable disease. I will urge everyone to get on the platform or get on their app. You can subscribe and engage in it, and it's really going to be helpful to you. Screening really helps. Early detection saves lives. There's 98% chance of survival, which is very, very high if you have been diagnosed of the prostate cancer very, very early. Yes, so everyone should just, if you know you haven't screened this year and you are within the age, as I've stated, please go to a facility nearby and get screened, and do this on a yearly basis. Add it to your annual labs, and also get onto the My Health Corp app and subscribe and engage in their workout sessions and in their nutrition, and you would have a healthy lifestyle. I do not wish to see anyone on this platform in my facility dealing with prostate cancer. So let's all start screening and let's all stay safe out there. Thank you for this opportunity, and let's have a good day.
Thank you very much, Dr. Kelvin, for delivering such a powerful and thought-provoking, um, um, presentation. We are most grateful. You've not just shared knowledge, but you've also sparked some curiosity and some motivation in all of us, and we are very grateful. Thank you very much. Our last session will be on the My Health Corp AI. Hello, Philemon. If you can hear me, please take over for us. Okay, so he's not available, so I would take the mantle. Then I'll take you through our AI. So if we all followed Dr. Kelvin during his presentation, he mentioned that one of the ways to help reduce the risk of prostate cancer is by eating well and also engaging in physical activity. And he mentioned the My Health Corp AI, of which I would take you through what it means and how it can help each and every one of us reduce our risk. So let me share my screen. It's up. I believe you can all see my screen. Nice one. So just as Kwesi Tebri mentioned during um, the introduction to the My Health Corp, he mentioned that we have two products on the market, which is the My Health Corp Pro app, where a customer can see the service of a professional, or a professional can directly onboard himself and create services. And also the customer app, where a client can book a professional. So this is the customer app, and this is what you see after you've successfully onboarded yourself. What you see here is your wellness dashboard. Then we have a place or a feature that you can book professionals. So if you want a nutritionist, if you want a physical activity expert, if you want a wellness expert, if you want a medical practitioner, this is a place where you can find all these people. So if you click a nutritionist or a dietitian, this is what you see. Excuse me. You see the professional with their prices, and if you want to know more about the professional, you just click on the pro, and this will come a picture of the professional, the about, and the certificates the professional has. Then you can proceed to click book. Once you click on book, you see this slots. The one in red means it has been booked by someone. The one in blue means slots that are available that you can book the professional. So if I'm to click any of them, I get this card pop up. I can reserve, next, and I'm obliged to choose the session either to be in person or virtual, depending on how I want it. Then I can confirm, then I can pay and book, then my professional would attend to me. That is one of the features. The next one is the AI. So this is, let's say, your virtual coach, your virtual personal trainer coach, that is going to help you with posture corrections, posture guidance, and all that. Let me put out this disclaimer that there is nothing 100% accurate, and this AI tool is the same. So I've had an encounter with some professionals who says this and this and that, but to state, we are still improving it, and we've at the moment we've made it in such a way that even the least exercise you do, provided it matches with what the AI is doing, it will count as a rep for you. So on the AI, we believe that before any activity is done, you need to assess yourself, your fitness level, your endurance level. How flexible are you to be able to take the exercise that you want to? So we've put together 4 main exercises, and they are free. So they are assessment exercises. If you click on Let's Go, this is what you see. And if I click the eye icon, these are the exercises: butterfly sit-ups, jumping jacks, squats, and push-ups. If I click on any of them, butterfly sit-ups, you get a preview video of the exercise, a small introduction or small information about the exercise. You also get to see the body parts that you are going to exercise on, how the exercise is done, some common mistakes, and some tips. Now, if you are done, you can now click on the blue icon here. There will be an audio check for an audio check that is going to help you proceed to click on the arrow. It will give you a position of how your phone is supposed to be placed on or against the wall. You click on it, and this is an alignment feature. If you properly align your phone against the wall, this is what you are going to see. Perfect. And now the exercise will proceed. We'll proceed to count. So I will do a demo. Yes. I'll do a demo for you to see how the exercise is done. Okay. 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 So the exercise is loading. There would be a feature, a silhouette that is going to capture you. So it's like a frame that is going to capture you. And once it captures you, it will automatically start giving you the posture correction and guidance that I made mention. So it will take a few minutes or a few seconds, then it will just come. Well, I think his network. So Peter, please check your network. So we do a push up. So just as I mentioned, a preview of the exercise, the body part you are working on, some common mistakes and some tips. Then when you hit on
exercise.
okay. So there will be a countdown to the exercise. Now you can proceed. If he does it right, it counts. So the frame is what you can see. The green feature that looks like a skeleton. So in 1 minute, let's see how many reps Peter is able to do. Don't give up. Continue. Keep going. Yes, you are closer to your goal. Exactly. Okay. So once Peter is done, you can see a result. So Peter was able to do 75%, and he has it there very good. Peter did 26 errors, burnt 3.12 kilocalories, had 8 errors. And if you click on the errors, you can see that keep your body straight, stay centered, no shifting. Then the other ones. So he did 99% accuracy, as you can see here. So if what we have here is a graph, the more you keep on doing, the more you see your graph. So you can track your progress with time, basically. So this is the AI for you. We also have a feature where, like a gamification feature, where you can have some challenges among yourselves. Maybe you want to organize a push-up challenge. We have that feature for you. If you come to challenges created, okay, so this, you can create a challenge among your peers. Then you can invite them. Maybe you can put a prize on who wins. If maybe the first person on the leaderboard has, let's say, 1,000 reps, the person is likely to get 5,000 cedis. It's something you can organize among yourselves. We also have a chat bot that if, let's say, you had an injury and you are recovering, you want a specific kind of activity to do, but you are lost or you don't know where to start from, you can just ask the chat box and it will fetch from the repository of exercises which one is best for injury recovery. So if I click, let's say, physical assessment, for instance, the chatbot is giving me an information, then it will give me an exercise that I can begin. So I would encourage all of us here to go to App Store, Play Store, download the My Hotcup app, and use the AI. I'll be taking your feedbacks. I dropped a number in the chat box. You can send me your feedbacks or whatever information or question you have or you want to ask. You can send it to the number. I'll drop it in the chat box once again for those of us who just joined to have it. Okay, so this is where we end today's webinar. I'm very happy, and I would say a very big thank you to everyone who invested his or her time to join today's webinar. I know it has been very educative, it's been inspiring, and I believe from today we are going to challenge ourselves in terms of our well-being. We are all going to put our health first. Our sincerest appreciation also goes to Dr. Kelvin Tete Ahulu for the insightful presentation. We also meet next week, same time, for a part 3 of the webinar series for October. See you all tomorrow. See you all next week, Wednesday. Have a good morning and have a blessed day. Bye.